Crystal Sherman, and this is my friend Jamie, and she has consented to be part of my video for the final in the class that I'm in. I'm going to assess her lymphatic and peripheral vascular system. I'm first going to start by asking her if I can assess her arms. Her arms are approximately in normal length. The temperature and color are normal. She's warm and dry, no moisture. I'm going to have her flip her arms over, and I'm assessing for scars and lesions, and there does not appear to be any. Her hair length is approximately equal on both arms. Her nail beds are normal at about a 160-degree angle, which indicates it's a normal nail bed, no clubbing fingernails or anything like that. I'm going to assess her brachial pulse on both of her arms. And on both arms, they appear to be +2 normal. I'm going to assess her radial pulses. And they are +2 normal as well. And her ulnar pulses. They're a bit weaker, and that is typically normal. They're about +1, equal in strength. Her capillary refill on her fingers appear to be less than 3 seconds, and this indicates that she has very good cardiac output and peripheral perfusion. Her skin turgor appears to be normal. If she was dehydrated, her skin would hold up just like how I'm pinching right here. The last thing I'm going to assess is the Allen test, in which will indicate if she has good perfusion in her radial and ulnar arteries. Excuse me. So I'm going to put a little bit of pressure on your wrists, Jamie. And what I have you do is make a fist with your hand. And as of right now, the color in her hand is getting very pale and white because I'm cutting her blood circulation off into her hand. Jamie, can you open up your hand for me? Her hand, it appears very pale, once again, because there's no blood going to her hand. And when I take my hand off of her ulnar artery, the blood should return very quickly, less than 10 seconds, and this will indicate that she has no blockage in her radial artery or her ulnar artery, in which this indicates that there's no blockage and it's completely normal, her blood perfusion. Okay. Next thing I'm going to take a look at are her legs. Her legs appear to be normal in length. Her color appears to be normal in each leg. There appears to be no varicose veins, no skin breakdown, scars. Her skin turgor is normal, just like on her upper extremities. I'm going to go ahead and assess her dorsalis pedis pulses, which are about +2 normal, and her posterior tibial pulses, which are +2 normal as well. Her capillary refill is less than 3 seconds, which indicates as well that she has great cardiac output and very good peripheral perfusion in her lower extremities. Jamie, can you wiggle your toes for me? Good. Can you feel me touching your feet?
Yes.
Does it feel normal?
Yes.
No tingling or numbness?
No.
How about the tops of your feet? Does this feel normal?
Yes.
No tingling or numbness?
No.
Okay. Jamie, can you go ahead and push against my hands? If you're stepping on the gas pedals, good. She has great push pulls. Go ahead and pull your feet up towards your head. Great. Great. Very good strength, equal strength in her lower extremities. I'm next going to assess her popliteal pulses. And they're normally on the weaker side, in which I can feel them. They're equally about +1, but very weak. Jamie, I'm going to go ahead and assess your inguinal lymph nodes. And generally, they're generally, when you assess the inguinal lymph nodes, they're smaller. They're smaller in size, but they're going to be a little bit softer too, in which they are. I'm going to assess your femoral artery. And they're very weak, about +1, but they're equal. Okay, Jamie. The next thing I'm going to do is, can you grab that tape measure behind you? I'm going to measure the circumference around your calves. And this is indicating to see if she has if she had a bigger calf on one leg than the other. This will indicate if she has any blood clot or a venous insufficiency, in which they're 15 inches in circumference, equal on both legs. And right now I'm going to also assess to see if she has any blood clot in her leg, a DVT. Jamie, is there any pain right here in your calf when I'm squeezing?
No.
No? How about right here?
No.
No. Okay. I'm going to have you just straighten your legs out again. And can you just pull your toes up towards your nose again? Do you have any pain in your calves?
No.
Okay. And this is indicating the Homan sign, which is negative because she doesn't have any DVT or anything. No pain indicates that she doesn't have a DVT. The next thing I'm going to do is I'm going to assess her arterial sufficiency in her lower extremities. So Jamie, what I'm going to have you do is go ahead and kind of sit back and lift your legs up into a V position. Very good. I'm just going to ask you to hold them there for about, I'd say, 10 seconds or so. And generally what's normal is her feet may become a little bit on the pale side because of the position that she's in. Okay, Jamie, go ahead and sit up on the bar stool here. I'll have her dangle her legs. And it looks like her color is returning pretty quickly, which is very, very normal. If it wasn't returning quickly, that would indicate that she does have an arterial insufficiency, and she had a blockage somewhere in her leg. Okay. That's the end of the video.